Before I had this surgery, I was miserable. I was very depressed. I didn't want to go anywhere. I isolated myself from people. My relationships with my husband just went down the drain. I had high blood pressure, high cholesterol. I had arthritis in my back. As a result of the weight loss, my relationship with my husband is just incredible. We do so many things together. We go out to the movies, we go dancing. After the surgery, I no longer had high blood pressure. I no longer had high cholesterol. I have so much energy now. I want to do more things. I want to go more places. I want to travel. I want to do things that I would never do when I was 251 pounds.
My health before bariatric surgery was pretty bad. I had diabetes, high blood pressure, high cholesterol, just something a 40-year-old shouldn't have to experience at such a young age. I feel great. I'm able to do things I couldn't do before. I've lost about anywhere from 85 to 90 pounds since bariatric surgery. I'm no longer diabetic. I no longer have high blood pressure. In fact, I have low blood pressure. Had I known before that I'd feel the way I do now, I just kind of wonder why I waited so long.
I was pretty sick, and I didn't realize how sick I was. I had high blood pressure, high cholesterol.
I was a diabetic, and I knew that that shortened my life.
This has changed everything. My husband bought a motorcycle, a Harley, in 2010, and I wouldn't get on it because I felt too big, and I felt that he wouldn't be able to balance me. Now, I'm asking him to go for a ride. My diabetes is completely gone. I'm no longer insulin dependent. If somebody asked me about the surgery and they wanted to know if they should have it, I would ask them, why are they waiting? I wish I wouldn't have waited so long.
My life was before rough, always sick. I weighed 300 pounds. I was on 4 different medications, diabetes. One day I just woke up and I said I had enough. I was 300 pounds, now I weigh 125, and look at me now. And I'm enjoying it. I don't look at him as my doctor. I look at him as a friend, a supporter, a person who cares, and he's been an angel. If it wasn't for him, I would have been 6 feet under.
The lap band is an operation that's been around for about 10 years. We place the band around the upper portion of the stomach. We achieve a certain compression that's appropriate for the individual, and once we achieve that compression, we get our expected outcome, which is where someone will lose at least half of their initial overweight. The unique advantage of the lap band is that it's a reversible operation. It's something that we can remove and the stomach anatomy goes back to its original state. But its limitation is that the weight loss tends to be less statistically over time. And another limitation is that we are dependent on a foreign body or device to achieve this. Second operation is the gastric bypass surgery. The gastric bypass surgery I like to think of as the most aggressive approach. What we do is we divide the stomach near the top. We completely divide this area away from the remainder of the stomach, and we make a new connection to your intestine. We're bypassing the rest of the stomach, which has a function, and this rest of the stomach remains, but we're detouring the way the nutrition flows. It's a very powerful operation for people who need to lose a massive amount of weight. It's a powerful operation for people who have severe medical conditions like diabetes or sleep apnea. Unique limitation is that it's not reversible. We've changed the anatomy of your stomach. We've changed the way your nutrition flows through your body. And potentially that can lead to some vitamin deficiencies that we really have to keep our eye on long term. A third operation that we do is called the sleeve gastrectomy. and it's really intermediate in how aggressive it is and intermediate in the weight loss results. The sleeve gastrectomy is an operation where we remove 75 to 80% of the stomach. That gives us very significant weight loss. Unique advantage is that we're not dependent on a device. We're not rerouting the flow of the nutrition. But of course, its limitation or disadvantage, just like the gastric bypass, is that it's not reversible.